Hi, welcome to March 25th press conference. My name is Lorie Glover, Black Hawk County Emergency Management Agency Coordinator, and I'm here today to introduce the speakers that will be here. I did want to give a brief update. The Salvation Army wanted everyone to know that they are still open. They are still seeing clients, and they're hearing a rumor in the community that they're not open and not available for clients. So I told them I would make sure that we pass this information along. And so right now I would like to introduce Dr. Nafissa Cisse-Egbounye, the director of the Black Hawk County Health Department.
Good afternoon. Yesterday, Governor Reynolds announced the first death associated with the novel coronavirus in the state of Iowa. I wanted to send my prayers and to the family and the respective community impacted. So with that said, community, it is important that we continue to practice the everyday prevention actions at all times. I know that I sound like a broken record. However, given that it may take months to produce a COVID-19 vaccine and antiviral drugs for treatment, we need to continue to implement the preventative measures to slow the spread of the virus. Please continue to practice social distancing. Stay at home and isolate when sick, washing your hands for 20 seconds often. Avoid touching your face, nose, and mouth, covering coughs and sneezes with the tissue, and clean frequently touched surfaces and objects. The current situation we are in is tough. We're all dealing with uncertainty for ourselves, our loved ones, and our community. However, this is a situation that I truly believe we'll overcome. We did it before in 1918 and in 2009 with the H1N1 pandemic. As Dr. Sharon Duclos communicated yesterday, it is natural to experience different and strong emotions. The current situation in our county, state, and country has created a lot of stress for people. So it is important that you take care of yourself and your family. It is also important that as adults, we help children cope with this situation that has impacted their normal routine. Children react on what they see and hear from the adults around them. I believe that it is our responsibility as adults to be calm, have the most accurate information, and provide the best support for our children. Here at the Health Department and also at the EOC, we take very seriously our role in the response. That is why we do our very best to give fast and accurate updates. We're also intentional in reading and listening to your concerns and responding to them. I am grateful to all our partners who work side by side with us to meet the needs of our community, but I'm also grateful to you all community members for your actions in preventing the spread of COVID-19. We community, we are a resilient community, and we will overcome the pandemic. Thank you.
Next, I'd like to bring up Yolando Loveless, who is the Director of the Veterans Affairs in Black Hawk County.
Good afternoon. First off, I would like to thank the 7,000 plus veterans in the county that have served our great nation and the state. And secondly, I'd like to give thanks to the public health system and our elected officials who have done an amazing job managing this pandemic. The Black Hawk County Veterans Affairs Office is open and operating at a reduced staff, and we're there to answer phone calls and to address veterans' questions and concerns. Our business hours remain 8 a.m. to 4:30 p.m., Monday through Friday. Currently, we are not accepting face-to-face appointments, but we are available through the phone to help our veterans with claims, pensions, trust fund applications, general assistance, and providing food bags from our stock food pantry. If you are a veteran in need of a food bag, please contact our office to make arrangements. We also recommend that veterans call the Northeast Iowa Food Bank for additional food supplies as needed. We at the Black Hawk County Veterans Affairs do not want to see none of our veterans suffer from hunger. If you are aware of a veteran that is in need, please contact our office at area code 319. The number is 291-2512. Or contact us via our Facebook page, and that's Black Hawk County Veterans Affairs /Facebook. Until further notice, our volunteer driver service has been postponed. So if you know a veteran who requires transportation to the Waterloo VA CBOC, please contact our office and make arrangements. My staff and I will help those veterans who have urgent or unique medical appointments get transportation to the Waterloo CBOC. The DAV van, which normally provides transportation to Iowa City for our veterans, has also been postponed. All scheduled veteran outreach events and VA appeals courts hearings have been postponed until a further date. If a veteran would like to check on their claims, they have a couple of options. One is by calling our office, or the second is by calling the VA National Call Center, and that number is 1-800-827-1000. And you can log into ebenefits.gov. And if you would like to inquire about eligibility for a veteran and their benefits, you can also visit va.gov, their website, or again, contact our office. Lastly, in this times like these, we are asking our veteran community to gear up and to check on their battle buddies, either by phone, by text, or email. Please let us know if there is a veteran in our county that requires assistance. Let us continue to pray for our deployed forces all around the world and their families. And if you can, donate blood to help out our community blood bank, And that's it. Again, from Yo, best of luck to everyone. Thank you.
Next, I'd like to bring up Reverend Dr. Mary Robinson, who is the board chair of the Black Hawk County Public Health Department.
I have been asked to talk about the role of the faith community as well as talk a little bit about the department. And as I was thinking about what I was going to say today, I thought about the fact that both of these are easy topics for me to talk about. First of all, I thought about the health department, and I see the health department as being the face of information. And I really take my hat off to Dr. Nafissa. I take my hat off to every single person, and I'm afraid to start calling names because I'll get in a lot of trouble. But because they have just done an awesome, awesome job. And I take my hat off to their families. A lot of times we don't think. We see them and we want them to always be there for us, but we forget that they have children, they have spouses, other family members who need them as well. And so I pray for you constantly. And I just say that I think second to none, we have the best health department, not just in the state, but in the country. And we want to support you, the health department, and all that you are doing, and want to be there to let you know that we believe in you, and I think you've earned that trust. And with that, with the health department being the face of information, then what is the faith community? I think the faith community is a voice of hope. This is not the first plague or disease that's ever entered into the world. We can go back centuries. We can go back to 1918. And we've overcome it. This too shall pass, my grandmother used to say. And but this is a little bit different for us because we have not been involved. And neither have we been involved. We don't even know what it is, essentially, that we are fighting. Every day there's something new that comes out. And so it's a little unsettling. And so for me, then the faith community's role is to be, as I said, that voice of hope. And the question still remains, do we still look to our faith, or is there something else that we want to grab onto? The boards of health, the CDC, they will share information with us, but ultimately, it's how are we going to react and take it in? And what are we going to do about that information? And when we don't know what we're going to do about that information, we have all kinds of questions. We feel like life is hopeless, and that's where the faith community comes in, to let all of us know that there is hope. That's where we can talk about the things that in my book, Scripture, which talks about the peace that passes understanding, and the fact that in my faith tradition, the fact that God is going to be with us and going to get us through this. And when we don't remind people of that as a faith community, then it allows them to give into panic, and it allows the questions, and many times they're the negative questions that control. And so as we think about what we can do as a faith community, first of all, I think we need to stay connected. I know that churches and religious groups are not meeting because of the no more than 10 rule, and I understand that and applaud that. And so that means that we have to find a way to stay connected. And it's easy today because we can stay connected online, whether it's Facebook or whether it's Zoom. And we need to help our family and friends seek the support of mentors and other leaders within the community. And what I'm concerned about is that we have the stress that's on individual families. And I've started reading more in the paper and hearing online, reading online and hearing on TV that experts are concerned about the mental stress that's going to be placed on families, concerned about domestic, possible increase in domestic abuse, concerned about increase possibly in sexual abuse and other kinds of abuses. And so I think that we, within the faith community, we need to reach out and let people know we're going to get through this. And we need to be flexible in creating and assessing our support groups, whether it's by phone or by email or text messaging or video calls. And we need to help our citizens be more calm. The facts are not going to change moment by moment. I mean, they might, but the fact is that COVID-19 is here. And so how can we be calm within this particular stress-filled situation? I think we need to be honest with people and let them know that it's understandable to feel anxious. It's okay to be worried about what may happen because we don't have all the answers. And we need to let them know that if they feel that they're getting more stressed, and I feel a little funny here saying this, by watching the news, because we do have KWWL here, but if you feel stressed by watching too much of the news, it's okay to turn it off. It's okay to take a break. It's okay to step back. It's okay not to look at that umpteenth headline that makes you feel funny inside. It is okay. and that there are some circumstances that cannot be changed. And I think the faith groups can help people know that we need to focus on maybe what can be changed and maybe modify our definition of what a good day might look like rather than the current reality. And I think we need to be concerned as well about our youth and our children. And they're home. They're not used to being coped up like they are. And find creative ways to relate to them. Use the members of our churches and members of our religious organizations to reach out to them. Have a buddy system. Do things face to face. Use the people in your organization, in your group, that maybe didn't get involved that much, and ask that person, would you be willing to contact our youth? Would you be willing to contact our kids? Families that you know are having difficulties, those are the ones that I think as church leaders we need, or religious leaders, we need to reach out, make sure we reach out to them. Yesterday at a conference with other pastors and the governor asked that as faith groups that we get involved with helping the food banks, whether it's volunteering, whether it's taking food, in whatever way they need us, something that gets our mind off of where we are. And then the other thing she asked was that we do, and I'm glad that you mentioned the blood banks, that surgeries still go on, that hospitals still need our help. And so we can get involved with a blood drive. Many of them are being canceled, but there is a huge need. And then lastly, childcare. We cannot meet, but we have empty buildings that are sitting there that maybe could be opened up to help with childcare. There are many essential businesses that cannot close because they are essential. So that means that the workers are still going to need care for their children. And so as we think about ways we're going to get through this, I think my message that I want to leave is that we are going to get through this. And that is what I call the voice of hope. We can do it. We will do it. And as my grandmother used to say, this too shall pass. Thank you.
Okay, I've also been asked to share that People's Community Health Clinic is available in Waterloo and able to help individuals who may be in need or not have medical insurance. They are open to all citizens who have that need. And so if you are ill or need a doctor and don't have insurance or can't afford one, please give the People's Community Health Clinic a call. That concludes the speakers we have for today, so we will open it up now for questions.
Yeah, I have a question for you, Lorie. The county buying private personal protective equipment at all, or are they still just relying on the National Strategic Stockpile?
We are not buying any. We are getting donations from private citizens. The governor also put out through the Farm Bureau today that she would like any farmers that have access to N95 masks and or gloves to give the local emergency manager a call. We did receive a small shipment from the National Guard in Des Moines yesterday of PPE equipment, and we're also getting another shipment tomorrow. So we are getting those shipments in, and we are making those requests.
And as far as long-term care facilities, we've now had, I think, 5 different cases in 4 different long-term care facilities across the state of COVID-19. Are you staying in contact with the long-term care facilities in Black Hawk County? And if so, what kind of guidance are you offering them?
Yeah, the guidance comes from the Health Department and the Iowa Department of Public Health. They fall under that same umbrella. But we are hearing from the nursing homes Of course, they are working with their staff to keep their residents safe. And then if they have any other questions that I personally can't answer or don't have the answer for, I refer them to the health department. But we are staying in contact. And we do have some of those who also need the PPE equipment.
Are they under any sort of special ability to be tested more than anybody else would be?
I'll have to let Nafissa answer that.
Based on the current testing guidelines, so if you have older adults, which are 60 years of age with fever and respiratory symptoms and chronic medical conditions, so they would be able to be tested.
But just simply working at a long-term care facility wouldn't necessarily.
So if essential services personnel do fall under that, yeah. Mm-hmm.
This might be another question for Lorie. We heard briefly on Reynolds' briefing today that there might be a little bit of daycare price gouging happening in the state. Have you heard anything about this countywide?
Countywide, we have not. We've had a couple of daycares that have decided to close after this week, but we are working with Child Care Resource and Referral here in Waterloo, and they are helping to manage that child care piece, most especially for our essential service personnel that have to remain at work and still have child care needs. But they are the ones helping with that, and they will be sending out information on how they can, people who need child care can access that.
And I had a question about the current status elevated. We see this on the screen every day. What would cause it to be upped? Would it be a death? Would it be evidence of community spread? Would it be a combination of these factors?
No. Josh Pecora can answer that with the health department.
Hello, my name is Joshua Pecora. I work for the Blackhawk County Health Department. So just a quick response to your question. Yes, our next step is would be when we identify community spread, a community spread case in the county, and you can see what the future steps look like. If you click that link, what does this mean? It'll show you the additional levels and what each of those levels mean.
And then I had a question about for Blackhawk County residents who might not speak English natively. Are these precautions and specific instructions being offered in other languages?
Thank you for the question. So when it started, we did provide the basic precautionary measures in regards to COVID-19. We are working with Waterloo Community TV to update the information, so that information will come also.
Will it be on the website in different languages?
Yes.
Have there been any more updated talks about curfews or shelter in place at all?
No, the governor has made it clear, I know yesterday in her press conference, that she's not looking at doing that, and kind of left it open for the counties to determine whether they want to do that. And so we are going to be having a series of meetings with the health department, other community agencies, and our elected officials to determine what that would look like and find out how we can do that, or if we do put something like that in place, what would it look like?
Is there a timeline for that at all?
We hope to have a meeting in the next couple of days to get that started.
Does that mean it's imminent?
If we can pull everybody together. You mean whether they do a shutdown?
Correct.
No,
Okay.
it's not imminent.